Hi, I'm Matt Shanis. I'm the Program Director for Internal Medicine Residency Program here at Montefiore for the Moses and Weiler campus. So at Montefiore, I think we train amazing physicians. We train the type of doctors that you really want your family and friends to be able to see. By the end of your training, you are easily able to care for complex patients, navigating through a challenging healthcare system. We really do this by providing and stressing resident autonomy. We want our residents to be making their own decisions and to be pushing themselves, but at the same time providing a tremendous amount of supervision and feedback from our faculty members. We do this in a safe learning environment. Our goal is for each of you to grow day by day incrementally, not holding anyone to any one single standard. The program really values clinical reasoning and evidence-based medicine because these are really the tools that we have as internists to learn and think and process cases and make sure we're coming up with the best and most thoughtful diagnosis. Here at Montefiore, we have a unique firm system, which is essentially taking our large resident pool and breaking it up into 3 equal parts. Our firm system really provides a residency mentorship from the very first day that you arrive here on campus. You have 2 different associate program directors who are assigned to you in addition to a chief resident each year. And those 2 associate program directors' main job is to supervise and to promote your career through the 3 years that you're staying with us. Of course, residency can be exceedingly challenging, but part of our family feel is to really make sure that our residents are getting through their 3 years as successfully as possible. And a large part of that is making sure we are invested and interested in their quality of life and their wellness. We have frequent social events with the residents. We make sure that the residents have specific wellness days built into their schedules where they have time off to go seek a doctor's appointment or just take a break. And even more recently, we've created a somewhat frequent group of residents who are meeting with a psychiatrist in a private environment where they can discuss their concerns and other issues that they may be having. One of the great things that we've built into our program a little bit more recently is multiple different pathways for our residents to choose from to really develop and hone their specific skills. A medical education pathway, the hospital medicine track, an intensified research track for residents who really want to dive in for 3 consecutive months for research. We have an innovation and biodesign pathway for residents who are interested in that as well. We've had a really good track record with our residents matching in exceptional fellowship programs and getting great job opportunities. We have a group of people that we call Monty Lifers, and basically there's a whole cadre of us who have been at Montefiore for a very long time. I myself have been here for over 20 years, and we have so many residents who continue on as fellows and fellows who continue on as attendings, and people who just enjoy the family feel of Montefiore and stick around. But it's not just our physicians. We have nurses and PAs and physical therapists and all sorts of other ancillary services that honestly I've known for decades now and really create a warm environment for me as I'm walking through the halls. Really takes a large institution and brings it down and makes for a small family feel. And all of this is really just to the betterment of our patients, knowing how to take care of them and how to operate within our system. Montefiore has a long history of taking care of the Bronx, and we have a strong dedication and commitment to this patient population. Working in the Bronx is a wonderful opportunity to learn and practice medicine. We're dealing with an extremely diverse group of patients. Probably the most important thing is the honor and privilege of taking care of our patients and taking care of patients who don't always have it so easy in life, dealing with issues of health literacy and poverty, and just being able to care for those patients, provide some comfort, give them a little bit extra care for their health and make their lives better is truly an amazing experience. Thank you so much for your interest in our program.